Hi everyone, my name is Sophia and I'm the chairperson of the Pan American Regional Office of IPSF, and I have the pleasure to be one of the IPSF delegates at the World Health Assembly this year, which is occurring virtually. So in this video, I want to go through some of the highlights of things that happened at WHA today that will give you a better idea of what happens at WHA. So in the morning session, we focused on public health emergencies, specifically preparedness and response. And we had Michael Ryan speak, who's the executive director for WHO Health Emergencies Program. And so the speaker touched on the effects of COVID on healthcare services and the importance of equitable vaccine distribution. A comprehensive strategy and plan for coordinated action was discussed, which should be placed in the context of each country-level response. The speaker also emphasized the importance of adequate supply chain to ensure that health workers and responders have training and equipment to do their jobs safely. Then the senior advisor to the Director General, Bruce Aylward, had the floor, and he discussed the accelerated development of tests, treatments, and vaccines, and emphasized equitable vaccine distribution as well. Afterwards, we moved on to the open discussion where various member states had the chance to express their interventions on the topic of the proposed agenda items and also had the opportunity to align themselves with various resolutions that were previously discussed as well. During the afternoon session, we had Ellen Johnson-Sirleaf speak, who's the co-chair of the independent panel, and she spoke about the devastating effects of COVID-19 and the need for concrete political action from national ministries. And the speaker also encouraged the collaboration of member states to draft a political declaration and a roadmap on pandemic prevention and response. Then the floor was passed to Helen Clark, who's the co-chair of the independent panel as well, and she discussed the recommendations of the independent panel on vaccine distribution that included removing barriers and scaling up manufacturing of vaccines through sharing of intellectual property. Then we moved on to Professor Wheeler, who is the chair of the IHR, or International Health Regulations Review Committee, and he discussed the roles of IHR in the context of COVID and recommended a new approach of alert and notices that should be developed and published by WHO Secretariat regarding health emergencies. Then the floor was passed to Dr. Tedros, and he discussed the independent evaluation of global response to COVID-19 and its results in hopes that our emergency preparedness will improve in the future. Afterwards, the various member states had the opportunity to express their interventions on national COVID-19 challenges and future steps. Overall, the value of collaboration and improvement in emergency preparedness were emphasized. We also had some IPSF delegates attend side events, so keep an eye out on social media for their briefings. So I hope you found this daily recap valuable and it helps you understand what happens at the World Health Assembly. Thanks for your attention.